My name's Bridge. I use they, them, or he pronouns. Either are absolutely fine. My background's in psychology, but I'm now doing a Masters of Sexology at Curtin University. I've worked in LGBTQIA plus peer support in a really wide range of capacities around Perth and around WA over the past sort of about 5-ish years. And yeah, I really care a lot about peer support as a sort of opportunity for just building stronger, healthier communities and bringing multiple marginalised communities together. I think there's just so much capacity that it has for that. So, here's my little look at that. Okay, so yes, Belinda obviously gave us a little acknowledgement of country just before, but I'd just also like to pay my respects to Wajak Noongar elders, past and present, and to acknowledge that the land that we're meeting on this afternoon was stolen, has never been ceded, and that it always was and always will be Aboriginal land. Cool. I'm gonna wait on that for a second. That was a very big slide. So yeah, once again, I'd like to thank you all for being here. I'm gonna sort of guess by the fact that you're all here, that you sort of started a bit of that process of learning more about the queer community and yeah, what you can sort of do, I guess, to just enhance your practice, whatever that is. Because I'm sure there's a really big diversity of different kind of areas around the room. But yeah, looking at ways that you can kind of improve the diversity in what you're doing and really keep an eye on your marginalised communities that you're working with. So this isn't necessarily going to be like a 101. I'm going to sort of, I guess, basically assume that people have got a bit of the basics down. But I'm really, really happy if there's anything that I cover that anyone isn't sure about. I'm really happy for people to raise hands or speak up or come and chat to me afterwards as well. Any is totally fine. I'm really, really happy to answer any questions. So we'll start off, I suppose, with what we already know. So I think the most important thing for any of us to remember when we're talking about any issues relating to either queer communities or people from CaLD backgrounds, that no individual is a monolith, no community is a monolith, no one has one singular experience. We're all really complex individuals, and communities are even more complex. And something that I always really like to keep in mind is that you'll always have as much diversity within groups as you will between them. So I think it's really, really important to remember that, you know, what we're sort of speaking about today cannot possibly sort of represent every single individual or community that we're speaking about. But just that it's, I think, important for us to be able to start having these conversations somewhere. So with that being said, I'll just preface that with it. At times I may sort of use some broader or more kind of generalized language. And I just, really want to make sure that people are aware that it's also coming from my perspective as someone who is a member of the queer community and not from a culturally or linguistically diverse background. So speaking from my experience as someone who's queer, as someone who is transgender, but obviously not here trying to speak for all members of those communities or any members of communities that I'm not a member of. So for ease of communication, I'll also, as I have done a couple of times already, refer to the LGBTQIA plus community as queer, as an umbrella term. That's obviously not a term, and I'm sure we've probably gone over this at some point. I know it's sort of addressed in the training, but it's not a term that is necessarily applicable to everyone. It's one that I like to use as an umbrella term purely for ease of communication rather than saying LGBTQIA plus every single time I want to refer to the community. But just another thing to keep in mind is that it might not be applicable to all spaces or to all people who are speaking in them. So what we do know is that there's really huge strides that have been made around the world in queer rights more broadly. What we do still know is that there's a lot of places that this hasn't been universal, right? That there's been differing levels of progress made in different places around the world, and where we're currently at is that we have, I think at the start of the year 69 and now 68 countries around the world where diverse sexualities and genders are criminalised. And there's, in terms of the status here in Australia, we've obviously seen huge amounts of momentum and like possibly sort of the most within the last kind of 5 to 10 years. Sorry, I'm just trying to find that. But it can obviously take a fair bit of time for broader society to kind of catch up with progress that is being made in these spaces. And we do know that things aren't all, you know, shiny parades and queer utopia in Australia either. There are still problems that we're facing here. We still have obviously ongoing barriers like difficulty accessing healthcare. We have social isolation, disproportionately low outcomes in both physical and mental health. And that's even just for those of us who are born and raised here. So then when you look at a lot of those same barriers, so healthcare, social isolation, poorer health outcomes, also are affecting culturally and linguistically diverse communities. And when you're looking at people who are existing in the intersection of the queer community and also are from a culturally and linguistically diverse background, that can get really compounded. All of those sort of effects of marginalisation and multiple marginalisation can really compound in the way that they impact someone's life and well-being. So yeah, as I've kind of said down the bottom here, there's also this whole concept of forming a minority within a minority that you then will often have then areas of discrimination within both communities, and even potentially with others who also share your identity. So just a few things that I've kind of put down here in the smaller points is just, racism, xenophobia, lack of understanding, and language barriers is a really big one within the queer community. Then there can be obviously queerphobia and homophobia and transphobia within cultural communities for some people. Huge lack of representation in both of young, culturally diverse queer people looking at the queer community and not seeing anyone like them, and young people from culturally and linguistically diverse backgrounds not seeing queer people as their role models in the same way, or not seeing anyone who is like them or looks like them in the same way. And the sort of where this all ends up for people is often with really reduced opportunities for community connection, for finding other people like them, finding spaces where they can feel safe and get some of that support, and then subsequently results in increased isolation. Cool. What we also know is that further axes of marginalisation on top of these experiences, because again, no one is a monolith. We often are dealing with, when we're dealing with, say, one marginalised identity, chances are there's also some other area of our lives where we're not sort of in receipt of like the hugest amount of privilege. So you'll see then if someone is, say, queer and from a culturally diverse background, that they might also be, say, a woman, or they might be transgender, or they might be intersex, or they might have a disability, and that then increases the number of additional challenges that they might be making, and further sort of increases that social isolation and lack of ability to find others like them or others that will even understand them. And I want to give a particular note here as well, like a particular note to culture-bound identities, which are, a wide variety of kind of gender expressions or sexual ways of being that exist in particular cultures and typically aren't really understood very well outside of those ones. So I'm talking sort of in terms of First Nations Australians, like sister boys, sister girls, brother boys, like two-spirit identities within Native American culture, and there's many other of these sort of culture-bound identities which then are further less understood outside of that culture than may already be affecting people. Community often, and even when people are able to sort of really, find that sort of sense of community again, find others like them in new countries, it's still, there's that bit of like, there's time, I think, to get to that point, and there's a lot of things that can go into someone's ability to finding that community, regardless of what it is exactly that they're looking for. And what we also know is that when we focus, as we sort of learn more about intersectionality and the strengths that it can bring rather than just the barriers, as we've sort of been focusing on so far, when people with multiple marginalizations are able to find that support and inclusion within their respective communities, their health outcomes really significantly improve. All of those things that we were talking about before. Finding multiple communities where your full identity is accepted enhances our well-being in a way that even just finding it in one community doesn't. Finding as many spaces where we're able to be fully seen and fully accepted for who we are, regardless of what that might look like for the individual, it's relatively intuitive, I think. It just makes us feel better, makes us stronger, makes us more connected to our communities, and subsequently makes our communities stronger and better connected. So basically what all of this tells us, as does most of the research in the area, that access to peer support and community connection significantly improves mental health outcomes in both queer communities and people from colour backgrounds. So peer support is essentially the term that we use for a very, very broad range of activities that are essentially involve some form of support, hence peer support, provided by trained or untrained people with a shared lived experience of some form. And it really sort of emerged in a major way in the sort of, obviously this sort of thing has been going on for probably about as long as we've had communities. But it's, really in kind of the more organised way that sort of fits kind of alongside the medical model, really kind of emerged as part of the ex-patients or health consumer movement in the 1970s, when a whole lot of people who had undergone a range of really horrific treatment in particularly sort of psychiatric inpatient care at the time, finally started speaking out about it and connecting with other people who had been through the same thing and realizing, hey, what actually happened to us wasn't okay, and really realized that there was power in being able to connect with others and help support each other as untrained peers who could then help reduce the need for these people to go back into a medical setting, which is where there was, a lot of trauma and a lot of kind of issues that had gone on for them. There's a lot of conflicting reports around this as well. It's a really interesting thing to sort of go and look into, and I've got a few kind of resources and stuff that I'm really happy to share as well. But what basically is that where we see that there's still existing barriers to accessing healthcare, as we previously discussed in the queer community, at times people from culturally and linguistically diverse backgrounds may have barriers to accessing sort of culturally competent care or care that they feel comfortable accessing. We see that peer support can provide, obviously not a replacement for anything. We never want to advocate for it as necessarily being a replacement for counselling or ongoing care or medical care, obviously. But it can provide a bit of that buffer. It can provide, I'm not a doctor, but I think like an adjunct is the term that sometimes is used for something like that. And yeah, also just sort of when you're factoring in then things, say like waiting lists and going and accessing services that maybe weren't the most appropriate at first, and having to sort of shop around a little bit, and all of the different things that can get in the way of someone being able to access their medical care, even if they do have access to it. Having that form of support somewhere in some form of like organised way can, yeah, be really, really helpful. And it, yeah, reduces isolation and promotes well-being in both the recipient and the person who's supporting. It's one of these really, really wonderful ways that we have of it basically improving well-being for everyone involved, it providing people who are really in need of that support with somewhere they can get their support from someone who is a member of their community, who has some form of understanding of what they're dealing with, and then also provides the supporter with a way to concretely give back to their community and engage with other members of their community at the same time. It's really wonderful. Cool. So what is community connection? This one's a little bit more straightforward, because it's essentially what it sounds like. It's, yeah, any form of like social connection, shared activity, anything that's kind of promoting that sense of belonging with other people with shared lived experience. As previously discussed, one individual might be a member of multiple different communities, and they can exist. They might get sort of different things out of engaging with their different communities. They may interact with their communities in different ways, but yeah, regardless of what it looks like, as long as it's sort of what that person's trying to get out of it, it, yeah, reduces isolation, promotes well-being, all of that good stuff as well. So this is, yeah, I'll go a tiny bit into the biopsychosocial model because I felt bad not doing any theory, but I also didn't really want to talk about theory, but I'll talk about it a little bit. Essentially, just this is a model designed by Yuri Bronfenbrenner, very, very commonly used in social work and community sort of fields. And I was essentially just kind of unpacking this to look at it and how it might apply in the sort of situation that we're looking at, where you have kind of an individual in the middle who is, say, like the individual factors are what we all kind of start off with, the things that we might call like immutable characteristics. So things like our sex, our gender, our intersex status if we're intersex, things like our sexual or romantic orientation, things like our age, things like our physical and mental health, things like our culture, race, ethnicity, things that are sort of fundamental to us. Then outside of that, we'll have our microsystem, where we have, say, like the education that we receive, what the situation is like with our family at home, what our kind of family dynamics are, what that structure is. Then we have our religious communities and beliefs. We have our access to healthcare services. And in that layer, we have what we're kind of talking about here with our relationships to our peers and social support. So then the mesosystem outside of this, it talks about the way that all of the factors within the microsystem interact with each other and subsequently interact with the later layers. I won't go into that one too far because it's getting a little bit conceptually messy at that point. But then in your exosystem, you have essentially your socioeconomic status, your physical environment, your employment or access to welfare. You have media and what that might be sort of telling you about various communities, about all of the other kind of factors on this, what media and politics might be telling you about your sex or gender, your orientation, your age, your physical ability, your mental health, your culture, your race, your ethnicity, how it's sort of viewed in that broader kind of scale. And then macrosystem you have the attitudes and ideologies of the sort of culture at large, and that's about sort of whether you're a member of a dominant culture or whether you're kind of dealing with that additional sort of marginalization there. And then you also have a chronosystem, which is essentially usually portrayed as like a big arrow along the bottom of the diagram, and that's to kind of show that all of these things like progress over the course of time, essentially, that none of it stays static. All of these things are sort of constantly moving. But yeah, it's just an interesting kind of model to think about sort of the ways that an individual's environment and the relationships they have to those around them can really sort of impact on their well-being. So with all of this in mind, for the individual, say, in the middle of that diagram who's struggling with social isolation, struggling with their mental health, struggling with any of the barriers that we've essentially discussed so far, what can we sort of do to help them? What can the community kind of do to help? So there's obviously lots of things that you can do to increase that kind of community connection and peer support. And ultimately, what it kind of comes down to is what will work best for the individual. That can look really, really different for each person. And it's about, really often the first kind of point of call that you'll have in those sorts of situations is really sitting down with someone, asking them what is going to help make a difference for them in terms of how they're feeling connected to their community, in terms of things that they might like to incorporate in their lives that they haven't had up until that stage. And that can, it can, for some people, look like, finding some sort of like social group or a special interest group of some description. The special interest group one I really like in particular, because something that we sort of see a lot in the queer community particularly is this real assumption that going and finding other queer people and finding those communities will automatically just kind of fit there. And we have this really great thing, as I've sort of hinted at a few times throughout the talk so far, whereby there's not necessarily always that much more that makes you that you have in common with other queer people other than just being queer. So in situations like that where someone's sort of being like, I'm engaging with lots of different spaces and just I'm not really feeling like I'm fitting in with any of them, I just don't really vibe with any of the people there, I'll quite often sort of suggest to them, try go and look for something that you're interested in, and you'll be generally really surprised in that the people that are interested in the same interests as you will have diversity amongst them. And even if they don't, it can be, it's not necessarily, as I've sort of again hinted at, it's not necessarily always about finding people who match your exact experience, because that's typically impossible, because everyone has their own kind of individual experience for the most part. But sometimes it can be things like finding, a book club or a gaming club or a community garden or something like that can help with an existing interest, or something, say, that someone's always wanted to try. It can be really, really awesome to just kind of sit down with people and be like, what's something you've always wanted to go and learn how to do? Is this a good time for you to maybe go and, join that club, or go and have a read about it or something? For some people it can be about engaging with peer-led services like MCCWA or Live and Proud, who are queer community services for WA. or getting involved with, say, Pride WA, who run our yearly Pride festival, and do various other things throughout the year. Sometimes it can be about looking for volunteer opportunities. Volunteering can also be a really good way of sort of enhancing that feeling of giving something back to one's own community that I talked about before. Obviously not applicable for everyone, but for people who are able to, it can be a really great opportunity. Obviously, religious and spiritual communities, really high, potential for really increasing that connectedness. And when you're looking at queer communities as well, we've got more and more kind of religious groups who are starting to pop up, intentionally filling that space of being explicitly accepting, because there can be a lot of fear for people who are a member of religious communities and are also either questioning their sexuality or gender, or know that they are not straight. So yeah, being able to sort of look for ways for people to reconnect potentially with religious or spiritual groups can be really powerful as well. Sporting groups, obviously, again, not for everyone, but like really great for people who get a lot of like benefit out of that. Obviously, getting moving and being able to do it in a community environment can tick a lot of boxes for people at the same time. And yeah, as I kind of said, it's essentially about finding what's going to work best for the individual. As I've said, what kind of works, so much of my job, I think when I'm in sort of peer support spaces and really trying to find ways for people to enhance their well-being and connect with their communities a little bit more. So much of that process is just sitting down and asking them, so what is it that you're actually interested in? What is it that maybe you haven't tried before but that you might be interested in going and trying? What is like something that we can do that just is gonna give you a little bit of that, like something to sort of work towards or look forward to, in some way that you're getting a little bit of that community interaction, and in a way that's going to be, enjoyable, or as enjoyable as possible to them. So, and the other thing that I really love with that too is that it can serve as that sort of reminder that we're capable of learning new things. We're capable of sort of going out and engaging in new social environments, and that actually being a really positive thing. And yeah, it's also just making new friends when you're sort of focusing on a particular task or activity can be so much easier than sort of environments where, say, you're going and sitting down and doing icebreakers with someone, or doing something when you're sort of not forced to just sit and make friends from a sort of like organized standpoint. It can be a lot more organic and a lot easier for a lot of people. And yeah, I can just I think that's probably just about where I'm at. How are we going for time? Good.